So we are going to talk about the drug class aminoglycosides, and we are going to talk about why it is used and the different purposes. So we use this for infection. And the generic names you see, there is a list right here: neomycin, plasmamycin, streptomycin, and we can see the suffix mycin. It's similar in all these drugs, and we can categorize and group them together just looking at the suffix, which is common. And we also know, as a rule, the first letter has to be, it should not be capitalized when we are talking about the generic names. And now we are going to talk about the uses, why we are using this. We use this for different kind of infections, for life-threatening septicemias. And again, a memory trip here, we use the itis word. So itis means inflammation. Whenever we are looking at this word, we know it means inflammation. So some kind of inflammation they're talking about. So these are the different kind of infections and different kind of things we use these drugs as. And the therapeutic effect, why we are using this, we know we are using this because we want to get rid of the infection. And admixture, what admixture means, whether we're gonna mix it or not. Do not mix. We are not going to mix this with another drug, and further we will see why we don't want to do that. Now we're going to talk about the action of the drug. So it can kill bacteria, mostly gram-negative and a few gram-positive. And another memory trick, as you see, the color of the gram-negative is red, and here gram-positive is purple. Why? So why it's like that? Because when we stain the bacteria, the negative ones turns out to be red and pink, and the gram-positive turns out to be purple. So just looking at the color, our brain can help us to understand and keep this in our mind. Just looking at the color, we can differentiate between the two kinds of bacteria. And now we are going to talk about some side effects and some assessments, like what we assess when we give this medication, and then we're going to talk about some drug interactions too. So it's very important that before we give the drug, we need to assess and look at the different labs, because we want to check if the patient is allergic. We have to check for the vitals and all the basic labs, the blood work we are looking for. And especially we have to see if the patient had anesthesia within 48 to 72 hours. So we need to make sure if any skeletal muscle relaxant was given, we need to withhold the medication. Why we want to do that? Because as we see in the drug interaction, that we already see that we are not going to mix this with another drug. Now here we see why. So the skeletal muscle relaxants, so if they combine with aminoglycosides, they may cause respiratory depression. So this is the reason why we don't want to mix this with another drug, and that's why we know that we have to look in between 48 to 72 hours if any skeletal muscle relaxant was given, and we need to check that. And then another side effects are the ototoxicity, which means the damage to the 8th cranial nerve. And here we see if the torsemide, furosemide, if they're combined with aminoglycosides, they may cause ototoxicity. Ototoxicity means damage to the 8th cranial nerve. And then another side effect is the nephrotoxicity. Now, what is nephrotoxicity? Another memory trick right here. So toxic means, as a general meaning, we know it's toxic. And nephro means nephron. Okay, it's related to the kidney. So we know there is something they're talking about, the toxicity related to the kidney. So obviously, as we see, observe urinalysis and kidney function, we need to see. And so as we see, the vancomycin, the cephalosporins, if they're combined with aminoglycosides, so they can cause nephrotoxicity. So this is very important, so we can relate all these things together. And instead of going on one thing, if we group them together and study them together, we can link them together for a better understanding that why we are doing it. Because rather than memorizing, if we understand the logic behind the things, and yes, there is memorization too, because we need to know the drug types, and sometimes we need to know that. But if when we memorize with understanding, it helps us to know the logic behind things. So this was all. If you like my video, please like and share and subscribe my channel. And you can also buy these templates on Etsy. And on Etsy, my shop is the same name as my YouTube channel, and which is Nursing Success Knows, and you can buy these templates on Etsy. Please let me know if you like my video, and put in comments if you want more videos like these or any videos related to another topics. Thank you.